Treating our entire community is one of the basic values of Swedish, of each individual caregiver within Swedish, and of the entire organization.
Swedish is committed to providing primary care, mostly because it's the best thing for the patient, and also because it's economically efficient to serve patients with primary care, as that keeps them healthy in the long run. When our patients are healthier, their families are healthier. When the families are healthier, our communities are healthier. The Ballard Teen Center, the Swedish Cherry Hill Residency Program, and the Swedish Community Specialty Clinic are 3 programs that allow us to serve the most vulnerable in our community. We start out with teens needing access to health care, both medical and mental health care, and that gets them started on the right foot.
High school students today have tremendous stresses that are on their lives that most people did not have to face when they were growing up, generations ago. As a school administrator, I frequently get presented with situations where I don't know what to do. And so to have on our campus medical professionals that can be there to assist me, to help our students, means the world to me.
Working with teens is a real specialty. They can come in here and get a level of support and understanding. I can take as much time as I want to see a student and answer all the many questions they have.
There's a wide range of students that come within our halls, and without having the teen health clinic on campus, these students would not have their needs met.
We're able to provide the full gamut of primary care. They come in, we can diagnose them, treat them for free, and they can go back to class.
And so having access to the Teen Health Center really allows our students to take care of their basic needs and know that they can then focus their time, their energy, their efforts on growing.
I always tell the students, we're here for them. We are their clinic. We help students learn how to help themselves.
It is not an exaggeration to say that having access to that Teen Health Center on our campus saves lives.
I am incredibly grateful that Ballard High School has the Teen Health Center. It's just really important to be able to know that when I go to school every day, if something were to happen to me, I have a clinic filled with really incredible people that can help me. The Teen Health Center saved my best friend's life freshman year. We were both so excited and just thrilled to come and finally be Ballard Beavers, and all of a sudden, for some reason, she just stopped being excited, stopped being enthusiastic. Teen Health Center was the one place that was able to get her to realize that she needed help, and then they gave her that help. Now she is doing incredible, and she's 2 years free of self-harm, and she just thinks of herself as a really beautiful person, and that's all you could ever want for a teenage girl, is to see themselves as beautiful, and she does. And that is 100% thanks to the Teen Health Center. I don't think she would be here today if it weren't for the care that came out of that center.
At Swedish, we do an excellent job of training residents, and at the Swedish Cherry Hill Residency Clinic, they particularly focus on working with underserved patients.
One of the primary reasons why people avoid going to see the doctor is because they simply can't afford to.
In our setting, we care for a population who themselves are quite under-resourced, may not have insurance. And so it's even more imperative that we actually have excellent physical exam skills, that we can't rely on a CT scan, which our patients can't afford.
Health and wellness and well-being is as much about preventing serious illness as it is treating serious illness. Our program offers excellent, full-spectrum family medicine training.
Part of the goal of family medicine is to develop primary care physicians who have an ability to care for children, adolescents, adults, and elders. And part of what most of us are drawn to in family medicine is that ability to have a relationship over time. If you know your patient well, you know their history, you know their medication list, you know what has worked for them and not worked for them in the past, you may need less technology because you have this richer narrative. And part of our obligation to our residents is to try and train them to be good stewards of public health dollars, but also individual patients' health dollars.
Every year we produce another 12 physicians who will work in the community, and we do that year after year. That's very gratifying to know that those physicians go on to do the work that all of us think is important.
I feel incredibly lucky to be a part of this clinic and just to be surrounded by incredible like-minded residents and faculty and staff who are all really working tirelessly to care for a very underserved and needy population here in Seattle. And that's the population I've always wanted to take care of, and I feel like I'm really lucky to get to do that in a really full spectrum, honestly, family medicine way. Part of what we can do here is provide really comprehensive care because we have the ability to work closely with social work and the time to really get to know our patients and think about them beyond just the sole need that they come in with, but really think about their larger social context in which we need to treat them. I have patients that I see who have been coming to this clinic for longer than I've been alive, and I think that just speaks to the fact that regardless of the fact that the residents change and the faces change, this is the same clinic with the same mission, providing the same kind of care to a very needed population. I just feel at my core that I'm doing everything that I've always wanted to do in exactly the right place and exactly the right way, and I'm just surrounded by such incredible people that remind me of that every day.
The Swedish Community Specialty Clinic connects patients who need specialty care, who otherwise don't have access to specialty services, with specialty providers that are willing to provide that care pro bono.
Swedish Community Specialty Clinic is different than the other community clinics because it does give patients access to specialty care with things like orthopedic surgery. Prior to this clinic, getting access to specialty care was extremely difficult.
The current specialty clinic was opened in 2010. In 2011, we opened a specialty dental clinic.
With the addition of our dental services, we've been able to reduce ER visits for dental services by 50% within the last year.
And now in 2014, we're up to 300 specialists across the system that represent every specialty that's available at Swedish Medical Center.
It's a very nice way to be able to provide community service in a meaningful way.
The way that patients usually will seek care at the specialty clinic is they will either be seen at one of the Swedish emergency rooms, or they will also be seen by one of the community health clinics or a Swedish primary care clinic. So if a patient is seen in the emergency room, say for a broken leg that needs to be fixed urgently, the ED physician will contact the orthopedic provider that is on call, and then surgery will either be done that night or the following day.
Serving the community through this specialty clinic, you're helping people get back to work, function in society. It's not just good for those individuals, it's good for the society as a whole.
I love being a dad. Being a dad is the most important thing in my life. I see all of the hope, that I have for myself in him. A couple months after he was born, I slipped on a puddle, going to the car and opening the door for him, and I broke my leg and had a spiral fracture. They said it's a common injury, but it is one that is extremely hard to get back to where you used to be from. Kind of put into question the whole, can I take care of my son? It's really hard to take care of an infant baby, and to do it on one leg, it's almost seemed impossible. All of those things I had hoped for in the future, it seemed like they were thrown out the window. I was scared half to death of what I was facing. I had to get something figured out as far as who was going to help me, and that's when I got a hold of the Swedish Community Specialty Clinic. They did my surgery, and they did a very good job. They actually were with me every step of the way and made sure that I was healing properly so I could then focus on being a father. And these weren't infrequent calls. I was there every week. They actually jumped in and took care of all the things that I wasn't going to be able to take care of, and just made sure that I was going to be able to focus on taking care of my son and healing up. I'm extremely grateful that I'm in a position now, healthy. I can look back on things and say that without their help, I never would have had that opportunity to be as good a father as I am now.